What's up, you guys? Welcome back to another Instagram Live, and I hope your weekend has been an amazing one so far. And I wanted to pop on here today because I have something to share. Again, Jimmy Rant mode. I like to share kind of what's on my mind. I like to think about things quite a bit, and I do think about things quite a bit on a much deeper level. It's very easy to get caught in the trap of only talking about diet, only talking about some lifestyle things, but I want to talk about something today that I think you're going to really like. So let me finish typing it in here, and then we'll get started here. Welcome in, guys. Thanks for being here. You're going to really like this topic today because this is one that I am seeing pretty often out there. And people just don't know what to do. So let's add some clarity to this subject. So welcome in. Hey, Kat. Hey, AK Hobbs. Hey, George. Hello, everybody. So what happens when people finally wake up and realize that they need to do something about their health? What happens? They start Googling, right? So they start Googling and they look up various things, and maybe they're interested in a keto diet. So they start typing in keto or ketogenic or low carb, high fat, or maybe they know some of the names of the people that are involved in the keto world. So they start looking us up. Okay. So they start looking and they read on one page that a ketogenic diet is one that is low carb, moderate protein, high fat. Then they go and look at another page, and on the other page, it says keto is low carb, higher protein, moderate fat. Then they go to another page that says the only way you can be ketogenic is if you eat grass-fed, organic, only real whole foods, never have anything off-plan. Then you read another page that says, oh, if you want to be keto and keep your hormones in check, you need to cycle in carbs and not be so strict. But then right on another page, it says be extremely strict and try to be in ketosis all the time. You see where I'm going here? Everybody's head starts spinning. They don't know what to believe. And at the end of the day, I think the new person hearing all of this and seeing all of this and listening to podcasts and following people and reading their blogs and reading the books and seeing all the seemingly contradictory information about the supposedly same diet, they see all of that all at the same time. They get overwhelmed and go, well, screw this. I'm not doing anything. That happens. I truly believe that happens. So the question becomes, who should you trust with your health? So if you're trying to make better health choices, who do we typically turn to when we need answers for our health? Well, the first obvious answer is your doctor. But unfortunately, when it comes to your diet, your doctor doesn't know a whole lot about diet. He or she was not trained in diet unless they're a naturopath or unless they're one that's educated themselves apart from the medical education system. In med school, doctors are lucky if they get, a couple of weeks worth of nutrition. Very lucky. And yet most doctors aren't even getting that. I talked to a Duke University med school student, fourth year, last year, and I told him, I said, hey, I need to know, how much education have you had in nutrition? He said, dude, it was 1 3-hour seminar. That's it. 1 3-hour seminar. So we're going to our doctors and we're putting our trust in the doctors to help us with our health, and yet they know nothing about nutrition. So that's why people start looking around. This is where I think the medical and nutritional health industries, so dietitians, traditionally trained dietitians, doctors and nurses, and all of these kind of traditional medical and nutritional health experts, This is where I think they have done us a great disservice, because they have not taken up the baton, so to speak, and carried the torch for giving people good information about their nutrition, which is why people like myself and others out here as empowered patients who have educated ourselves and are now trying to pass on that education to other people, that's why we have platforms at all. And so this is why people move to bloggers and podcasters and watching people on Instagram lives. It's because the mainstream has let us down. So in light of that, who should you trust with your health when it comes to all of these other people that are speaking? Well, generally speaking, try to find some medical professionals or nutrition professionals like registered dietitians who have had their eyes opened and they understand exactly how nutrition works and they're not just parroting information. There's a whole slate of nutritional therapy practitioners who understand nutrition and how to help their clients get healthy. Nutritionists in general, on and on and on I could go. Those are kind of, if you can find people like that have credentials and understand what's going on. But even in that realm, it's a little murky because sometimes those people will take their own personal bias and apply it to everybody. And again, that doesn't help you. So then you, the person watching this, you are left trying to figure out who should you trust with your health. And I'm about to tell you exactly who you should trust with your health. It's not a doctor. It's not a dietitian. It's not a nurse. It's not really anybody that you think it would be. Guess who it is? It's you. You have to trust your own instincts about your health. Now, that's not to say if you break your arm, you shouldn't go to the emergency room and get them to fix your broken arm. That's where mainstream medicine shines. That's not to say you should not consult with a nutritionist, a nutritional therapy practitioner, a dietitian, whatever, whoever you want to go to about learning about your diet and fixing it. That's not to say you should not go see those people. You should. But you're still your best health advocate. You are. You're the one that you need to trust, because every single one of us is bio-individual, which means we're all unique and we all have unique needs. And you, as the person who has known you the longest, that's you, you know what's best for you. You know that when your body is out of kilter, you got to do something about it. You know best, and you don't lie to yourself. Maybe you do lie to yourself, but at some point reality sets in where you can't lie to yourself anymore. And this is where all of these different pieces come into play. So your doctor plays a small role in kind of keeping tabs on your blood markers. Your nutritional therapy practitioner, your dietitian, your nutritionist, whoever you go to see about your diet, they help keep tabs on what you're doing in your diet. Your personal trainer at your gym keeps tabs on your fitness level, so forth and so on. All of those people are merely the consultants in your health. And so if they're consultants in your health, they're not telling you what to do. They're merely giving you their educated guess, their knowledge and experience, and the wisdom that they've grown from seeing so many people. You should trust that, but not inherently to the point of blindly trusting it, that that's all you do is follow exactly what they say. Far too many people have let go of their own responsibility for their health. And so who should you trust with your health? It's you. And I want you, if you don't feel like you are empowered as a patient, you need to get knowledge. You need to fill your brain with really good quality information, because it's that information that's going to change your life. Because then it's like having the answers to the test before you go to the test. And you kind of know what's coming. And when those things come from the mainstream medical community, mainstream nutritional health community, you kind of know how to push back if you need to. they're pushing a prescription medication. Yeah, I've heard that those statin medications, they actually increase your risk of heart disease. They increase your risk of diabetes and cancer. They don't really lower your risk of having a heart attack. And they'll give me joint pain. I know about all of that with statin drugs. So why, doctor, are you pushing this statin drug on me? That's one example of how you now have become your own best health advocate. You've trusted yourself and what you've learned, and now you're applying it to your healthy choices. A lot of people don't like doing that. A lot of people are like, well, that doctor went to college all those years and went to med school and residency. He has to know everything about everything. Doctors are heroes in my book. I think they do amazing work, but they most certainly do not know everything. And they most certainly are under pressure to not really give a crap about you personally. They're under pressure to see as many patients as possible, putting them through a system, treating them basically like lemmings, that you're lucky if you get 5 to 7 minutes with your doctor, and then you're out of there. Who can have a meaningful conversation with the person that they're entrusting themselves with their health, with their health? Who can get a nice conversation with a medical professional in just 5 minutes? Nobody can have that. And it ends up being this, well, you have this ailment, and this ailment, so here's this pill, and this pill. How does that help anybody? And yet that's the system we're in. That's where we are. That's why, again, people are going outside the mainstream of medicine, and they're turning online, trying to find anybody desperately, trying to find anybody that's making sense when it comes to talking about the health, because a lot of people their eyes are getting opened. Sugar is not a great thing, and yet they're putting it in every single packaged food. Grains are not as healthy as they've been made out to be. And again, it's put in so many packaged foods. And they're still vilifying dietary fat. You go see any doctor, any mainstream doctor, they're going to tell you cut your fat, because they want to reduce calories. They want to reduce your CVD, cardiovascular disease risk. And it's all based on old information. So who should you trust with your health? You've got to trust yourself. So find those resources that are good. Find the ones that are trustworthy. So I mentioned earlier, try to find medical professionals and nutritional health professionals who are talking common sense language. But even try to find people that have done it and are living it. And really at the end of the day, pass your BS meter. If they're talking information that really makes sense, stick with that person. I know there's a lot of people, and I'm not going to name names because I'll offend some of my friends that I don't mention. There's a lot of people out there that are doing some really, really great work. Here's who you should avoid, though. It's so easy to say follow people you trust, but sometimes some accounts can get kind of couched in looking like they're trustworthy, and then you realize, okay, yeah, they're not in it for the right reasons. So if all it is a constant sales push, you probably should avoid those. And you know the ones I'm talking about. They're out there where they're only in it to make a buck. And I'm not against people making money, but I am against it being their first and foremost thing that they do. So if you put information first and you try to help people, when you help people, they're more than happy to reward you by, if you have products to sell, buying those products. So that's my philosophy in business anyway. So if the person that you're following is overly salesy, you probably should move on to someone else. So that's what I wanted to share with you. Who should you trust in your health? It's you. So let's see what you guys have to say. George says, yes, it happened to me. I did not have a good experience with doctors. Yeah, unfortunately, and again, mainstream doctors, they have a hard job, and people don't realize this, but when the Affordable Care Act got passed, it wasn't just the action on patients and how much healthcare costs and all that. they radically changed with that law, all the behind the scenes stuff that doctors have to deal with now. So doctors have specific codes they have to use now with every single patient. They have specific note-taking, electronic note-taking that they have to do. It's required now. Before it was an option, now it's required. And that has added so much time to their day. So imagine this, they're seeing a patient for 5 to 7 minutes. They're having to spend at least 20 to 30 minutes on each of those patients just doing the note-taking paperwork, so to speak, the paperless paperwork, to put it all into the electronic system. And they've got a time limit on getting that in. So they're under a lot of pressure, and they're under pressure to see a lot of patients. They're under pressure from pharmaceutical companies that are throwing money their way to promote pills. That's why every time you go see a mainstream medical professional, they're trying to put you on at least 1 or 2 or 3 pills. They have to do that. That's part of the job. And sometimes it's part of the standard of care that, again, got stricter and stricter once the Affordable Care Act passed. So I have a lot of compassion for medical professionals. A lot of them are getting out of the game because it's just too much pressure and it's wrecking their own health. So ironic, right, that we're wrecking the health of the people that are in charge over our health because of a change in how we do things. It's strange. George says, my trust is in God, looking for the cause and the solution. And George, you're one of those people that's an empowered patient. You're constantly trying to educate yourself and listen to podcasts and read things and follow people like me and learning, constantly learning. So kudos to you and keep up the good work, buddy. Hello. Welcome in, everybody. I just finished my rant all about who should you trust in your health. The answer, by the way, is you. Jeanall59 says, I just told my daughter that I'm my best advocate for my health. And Jean, you have learned it, and I am so proud of you. Unfortunately, people are scared when I say things like this of you have to be your own best health advocate, and people are like, well, I don't have any of the education. I don't have any of the knowledge. I don't know if what I'm doing is actually right. Guess what? Neither does your doctor. They don't know what they're going to put you on is going to work. Have you ever gone to see a doctor where he says, oh, yes, I have the answer to why you're dealing with fibromyalgia. Take this pill for the rest of your life. Maybe he'll say, take this pill, and then you don't feel better. Oh, okay, don't like that pill. Let's try this pill. And then that doesn't work. And then the next time, oh, well, let's try these 2 things and let's do a procedure. And it just becomes this constant guessing game. Well, guess what? You can guess just as good as your doctor. Again, with an acute issue like a broken arm, twist your ankle, sprain your ankle, you want to go see mainstream medicine. For chronic health issues and for information about your diet, don't go see your medical doctor about that. Go see someone like a nutritional therapy practitioner or an educated nutritionist or dietitian that understands all the ins and outs of nutrition as it relates to your health. So kudos to you, Gene, for being that health advocate for yourself. Weege 0706, because nobody would take responsibility for our health but me. Exactly. And this is something I try to just impart on people is, look, at the end of the day, you know you. Nobody else cares about you as much as you. Maybe you've got a spouse or a mom or dad or something that cares about you deeply. But at the end of the day, you really care about you. You're working on trying to improve you. If you're following somebody like me here on Instagram Live, you actually do care about yourself enough to want to try to learn and apply things. So yeah, at the end of the day, it is about you finding what works for you. Life in Pigs 50, I come from the medical field and never considered IR would be my issue, insulin resistance. I'm heartbroken that I spent 10 years with doctors who told me I was just weak because I couldn't lose weight. Thank you, Jimmy and Christine. Life in Pigs 50, welcome to the fray, my dear, because a lot of people, and I'm going to get real here, guys, because that's what I do. A lot of people go see their doctor and they have weight on their body and the doctor kind of looks at them with scorn. Never mind, maybe you had a whole lot more weight on your body. Never mind, all your health markers look spectacular. Oh, you need to lose weight and you need to cut your fat and calories. And you go exercise at the gym. That's kind of the pat answer that a lot of doctors are telling patients that have weight on their body. And I have something that pops above my head as a bubble that I can't say on a Sunday morning, but you can imagine how discouraging that is to people. Again, empowered patient, you're the boss. If they say stuff like that, you kind of smile and go, thank you very much. Thank you very much. That's all you can do, because at the end of the day, they don't know you as well as you know you. Gambling 123, this is why listening and knowing your body is so important. We're all so different and we're all individuals. It's not a one size fits all. I'm loving this information. Thank you, Gam. Yeah, I actually said as much. I went and testified before the USDA Dietary Guidelines Committee in 2010. I got the opportunity to go to Washington, D.C., and I was one of 2 people in the entire nation who showed up that was just an average everyday person. Everybody else there that gave testimony before this committee, everybody else was from industry. So the soy industry was there, and the grain industry was there, and the sugar industry was there, and the so forth and so on. Me and one other lady that just happened to be going through town at the time, that was a real food advocate. She said, hey, can I testify? And so they let her. She was the very first speaker, actually. I was on down the line, but she gave her pitch for why they should really push real food as the first option, and then from there let people kind of figure out which real foods work for them. When I went up there, I said, yeah, there's no one size fits all diet. It's like trying to make all of us wear a size 8 shoe. Could all of us wear a size 8 shoe? No, because some of us have bigger feet than 8. Some of us have smaller feet than 8. So we need to have different choices. Just like we have different shoe sizes, we need different choices for people to choose from based on their unique needs. Now, will there be overlap with some people being able to do well in the exact same diet, shoe size? Absolutely. But let's give people those options and stop trying to be a one-size-fits-all size 8 shoe. Anyway, that's what I did when I testified. And interestingly, the man I was sitting right next to as we were waiting to go into line to give our testimony was Dr. Neil Barnard. And if that name isn't familiar, he's the guy that runs the Physicians Committee for Responsible Medicine. It's a vegan front group. So I remember I sat down and he said, hi, I'm Neil Barnard. I said, I know who you are. I had him booked to come on my podcast like a few weeks after this experience. And it was just so funny because he was totally oblivious to who I was. He knows who I am now. It's pretty funny. All righty. Elaine Guay says, hi, Jimmy. Have you been listening to the podcast debate between Peter Attia and Dave Feldman? What are your thoughts? I'm more confused now than ever before about LDL. I have not heard those specific things. Thank you for sharing that. I know both Pete and Dave, and I know Pete is very steeped in the notion, and this gets to the point of what we're talking about here today, who should you trust with your health? Because Dr. Peter Attia has made a 180 on his belief. He used to believe it was the small, dense LDL particles that were the problem in cardiovascular disease. And he has shifted his position because he's been heavily influenced by influential lipidologists. And lipidologists think it's all about the total LDL particles. So I'm getting a little bit deeper than I wanted to on this Instagram Live. But in short, LDL on an NMR lipoprofile test, they show the different particles. And there's big particles, there's little particles. And Pete and Thomas Dayspring, the lipidologist that's consulting him, they all seem to believe that if you have very high levels of LDL particles in general, both large and small, that you're at great risk for heart disease. I don't know what Dave has articulated, but if my understanding is correct, Dave has been doing his protocol where the LDL particle number can come down with 3 days of very high fat before you go get the test run. So I'm assuming Dave has made the case for, well, look, you can manipulate that number so it kind of shows clearance matters and how you get to that number matters. So no, I have not heard that. Thank you for bringing it to my attention. I've seen it out there. I've been extremely busy lately, but I will try to make time to watch that and maybe give some post commentary here on Instagram. But thank you for letting me know. But this gets back to our question, who should you trust with your health? Because you'll hear people like Dr. Peter Attia. Oh, he's a medical doctor, so he should know all this stuff. And he sounds very intelligent and he's got that great voice and blah, blah, blah. And then Dave, oh, he's just a citizen scientist, so should I believe him? And I don't understand why I would over a medical doctor. Again, you. What sounds right to you? What's your experience? What have you seen in your own life that works for you? For me, on that particular subject, I don't worry about LDLP. I don't worry about the total LDL particles. All I look at is small, dense LDL particles, because the lower you can get that number, you can have a 3,000 LDLP. But if your small, dense LDL is well under 500, you're okay. You're okay. I truly believe that. And Dr. Dayspring used to kind of chastise me of, well, you're just a ticking time bomb waiting for a heart attack. And I would keep pushing back on him, and I'd say, hey, look, I've had a CT heart scan that shows I have a big fat 0 calcium buildup, calcified plaque buildup in my arteries. Where's the disease? What are you talking about? And of course, this has been many years ago that we had those conversations, and he was always like, dastardly, oh, you must lower, blah, blah, blah. So again, you have to figure out what passes the smell test for you. Ketoneogenesis, I question everything and plant thought seeds with people who don't know they can take charge of their own health. It's incomprehensible to me that it sometimes never occurs to people that they can. And I find it's my job to give people permission to do that. It sounds so weird that I would need to give you permission to be your own best health advocate. But again, it's a cultural thing. Especially here in America. I don't know what it's like around the world, but in America, patients have long been inherently trusting of their doctors. I do sense that's changing. It's why functional medicine practitioners are popping up. It's why nutritional health professionals like my wife, Christine, who's a nutritional therapy practitioner, why they're popping up and becoming more and more the go-to for people. People are becoming less and less trustworthy of doctors and more trying to take back control of their own health. I would have liked to have been on a fly on that wall in DC. Did you feel it did any good? Good is subjective. You're talking about the where I testified before the USDA dietary guidelines in 2010. I think it was at that point, and I had a buddy of mine that was there that was observing, and the buddy said, they were looking down at their notes with most of these industry people when they were kind of given their spiel. But when I started speaking, they all looked up and they stopped doodling or writing down, and they were all staring at me. So I think I did possibly have a little bit of an impact because it was the 2015 guidelines where they lifted the restrictions on cholesterol. It's not a nutrient of concern, they said. It was in 2015 dietary guidelines that they said, okay, we're gonna loosen up on the restriction of dietary fat. So maybe, just maybe, it did have a little bit of an impact. And I'm really anxious to see what happens in 2020 as we incrementally get closer and closer to an acceptance of multiple forms of diet for people to choose from, one of which should be a ketogenic diet. Let's see. Speaking of, I went from a shoe size 8 to about 7.5 or 7 after keto. Yeah, people don't realize you lose weight in your feet when you lose weight. It's pretty cool. When I questioned the statin being prescribed, doctor said, if you were my sister, I'd still prescribe it. To which I replied, I guess you don't like your sister. That is a great response. Oh my goodness. That's awesome. if you hack yourself before a test, is it a true result? So I assume you're talking about like the Feldman protocol. And see, this is the point. Any medical test that you have run, and if you're just joining us, we're talking about who should you trust with your health, and it's you. Any medical test that you have run, you have to know is subject to flaw. And it's subject to whatever the circumstance is at that very moment when the blood is being drawn. So if you're highly stressed in the middle of getting a blood draw, you're going to mess up some of those numbers. So really, these are just snapshots in time and should never be gospel truth about whether you should go on a medication or not. What you're looking for is multiple readings over time that then show you some kind of a trend, either up or down in certain numbers, that will give you more clarity on where you should go in your health. Never, ever, 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 ever believe one singular test means anything in your health. And I'm going to give you an example. So my PSA, and that's the prostate test that all the guys run to see how their prostate health is doing. My PSA has always been well under 1, and under 1 is extremely healthy. 0.8, 0.7, 0.9 pretty much stays there pretty much all the time. And one time I went to my doctor and it was 20.7. 20.7. So nearly 21 times higher than it usually is. And of course, the doctor kind of raised his eyebrow at that. It turned out I had a urinary tract infection. And it was my first sign that I had one. And of course, went through the protocol to fix that. After the urinary tract infection was gone, I got retested with my PSA. It was 0.8. So it goes to show you that one singular test doesn't really tell you much. You've got to look at the trend over time. Thank you guys for being here. This was a great chat all about who you should trust with your health. And if you missed the punchline here, it's you. You're the one. You're the one that needs to kind of educate yourself. And here's the other thing. Anybody that ever stops learning, you stop growing in your knowledge. And when you stop growing in your knowledge, you become stagnant in what to do about your health. It's why I remain a student even all these years after I changed my diet. I still am constantly learning. I am looking for people to interview and talk to and educate so then I can pass on that education to you guys here on Instagram and through YouTube and through various places that I'm posting. So always remember, you're your own best health advocate. You're the one you need to trust at the end of the day. Everybody else is merely consultants in that trust of yourself. So trust your instincts, never stop learning, and then go live your best, optimally healthy life. All right, guys, that is it for this Instagram Live. Thanks so much for watching. We'll be back again real soon. Bye.